Hello and Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the upper right 6 and 7 and the lower right 6 and 7. On the 3D rendering, you can see that the lower right 7 has significant bone loss, whereas the lower right 6 also has bone loss. The upper right 6 and 7 can show you considerable periodontal bone loss as well. On the panoramic view, we can also see that there is a distal cavity on the upper right 6, where is a broken the endodontically treated or a trimmed out lower right 6, and then you've got radiolucencies around the lower right 7. Now this is the transaxial view. The transaxial view is basically the proximal view. On the proximal view, you will be very clearly able to see that we've got the lower right 6 has two mesial canals, but these are very sclerotic canals, and it is going to be very difficult to navigate through these canals. But however, you've got two canals, the mesiobuccal and the mesiolingual. The approximate working length for this tooth is going to be 15 for the mesials and approximately. And you also have two canals in the distal, so you've got this two canals which join to form one, and the working length is going to be 15 for the distal as well. So the lower right 6 has two canals, in the mesial, two canals in the distal, and no periapical radiolucencies can be observed. This is the lower right 7. The lower right 7 unfortunately has significant bone loss on the buccal as well as the lingual as well as the mesial and distal aspects. So this tooth will need to be extracted because this is probably grade 3 mobile and has no bone support whatsoever. Moving to the upper right 6, the upper right 6 has a restoration present in it. The upper right 6 has, this is the parietal root, you've got the MB root, the mesiobuccal root, and you've got MB1 and MB, a slight MB2 present as well. This is the distobuccal root, as you can very clearly see. You've got shorter roots and a huge bulbous crown. And as you're moving distally, you will be able to appreciate that there is a distal cavity present in this tooth, which is present right here. This is a class 2 restoration. We don't see periapical radiolucencies present in this tooth. So this tooth can definitely be treated non-endodontically. Moving to the upper right 7, the upper right 7 has significant bone loss as well. Here you can see that there is presence of calculus, so there is definite periodontal disease. The bone support in this tooth does not seem to be adequate, so that is something that needs to be evaluated clinically. That if this tooth has significant bone loss, so there might be a need for an extraction, followed by not an immediate implant, but at least followed by bone grafting for future implant placement. So this is the situation of the upper right 7. The only one thing that we want our kind doctor to also see is the lower right 3. The lower right 3, mashallah say, has two roots. This is a canine with two furcated roots, and there we go. So this is the chamber. We've got a lingual root and lingual canal, and a buccal root and a buccal canal. So this is something that we wanted our doctor to see, because this is not a usual occurrence. This is absolutely rare, but this is something that if this tooth ever needs an endodontic treatment, the doctor should be well prepared. Thank you very much.